Total ankle replacement is similar to total knee replacement. The ankle, when it becomes arthritic, the bone and the cartilage wears out. So what we do is we replace the ankle bone with metal parts on the tibia and as well as on the talus, and we place a plastic portion in the middle that allows smooth motion and reproduces the anatomy of the native ankle. And we are currently on our 4th generation of total ankle replacement. So we use CT and 3D reconstruction to fit every patient with their own specific components as well as instrumentation. This allows us to have better outcomes and for our patients to enjoy better function. A total ankle replacement typically treats end-stage arthritis. And what I mean by that is that there are a number of ways that ankle can become arthritic. It can be from ankle instability that's chronic. It could be from a traumatic injury. It could be from old age. It could be from rheumatoid arthritis. But regardless, there becomes a point where there's no cartilage left, where there's essentially bone-on-bone contact. And it's not until then, after all the conservative measures have failed, that we have what I consider a great option in total ankle replacement. The recovery process for total ankle replacement is just like any other orthopedic procedure. You need time for the skin to heal. This is typically 1 to 2 weeks before the sutures come out. After the skin is healed, we're still immobilized because we want those parts to integrate into the bone. And so there's a period of non-weight bearing, particularly the next 2 to 4 weeks. We want to maintain motion, so I might give you a boot or a soft cast, something where we can protect the ankle and then slowly introduce motion. Motion and weight bearing typically start around 4 weeks for most total ankle replacements, and most of my patients are starting physical therapy at that time and then moving on to progressing out of the boot somewhere around 8 weeks. I tell patients they can expect to be out of the boot into a regular shoe typically somewhere around 12 weeks. So, there's a continuum there, but that's the typical healing process and recovery for total ankle replacement. Total ankle replacement is now in its 4th generation. We have better instrumentation for placing the implants. We have better materials, and our post-op protocols are much better. We're starting to see survival of the implants up to 95%, 10 years plus. But these are still parts that need to be replaced. And the more we wear them out, the higher impact activity that you do, the faster these components could come under wear and lead to loosening. So we ask most of our patients to stick to low impact exercise, such as walking, hiking, biking, things of that nature. The common risks for total ankle replacement are similar to other orthopedic procedures. There can be an infection, there can be bleeding, there can be damage to surrounding structures, and loosening. And I think specific to total ankle replacement, we see component loosening is one of the main complications from a total ankle replacement, and that just is because of the anatomy of the ankle. There's so much stress and force coming across the implant that they can loosen over time, but we've come so far with regards to how we place them and the accuracy that we place them with that we're seeing less and less of these complications. Total ankle replacement is typically done in the inpatient hospital setting, but we are seeing more and more done on an outpatient basis. That could be at an outpatient surgery center or an inpatient center with same-day discharge. So there are many options depending on the level of care that you need. One of the main things to consider for patients who are interested in total ankle replacement are how important is your motion for you? Because we do have alternatives for end-stage ankle arthritis. which is ankle fusion, which is the gold standard. But if you are somebody who is mobile, who is healthy and wanted to maintain an active lifestyle, total ankle replacement could be right for you.